afternoon, Doctor. My name is EshikaParuchuri. I'm a sophomore at Woodbridge Academy Magnet School. Firstly, I would like to thank you for joining me in this initiative. My main objective is to educate adolescents around the world to help them construct a healthier lifestyle by working with experienced doctors across different specializations. Welcome to the Healthy Teens podcast. This is episode 7. I hope you are keeping well. This month, I'm joined by Dr. Anthony, who specializes in physical therapy. He is a doctor of physical therapy with experience in outpatient rehabilitation, inpatient rehabilitation, and home health. Currently, he works as the director of rehabilitation at Ivy Rehab in Monroe Township, New Jersey. And for this episode, we'll be focusing on multiple issues related to the musculoskeletal system, like posture, muscle movements, and injuries faced by teens, as well as the steps that can be taken to have a healthy body and lifestyle. And now, Dr. Anthony, can you give us a little introduction about yourself?
Well, thank you, Eshika. So just call me Anthony. I'm fine with that. So I've been a doctor of physical therapy since 2016. What can I say? I love what I do. I've been doing outpatient the entire time, but I've always held usually multiple positions, director since 2021, but I've done outpatient, I've done home health, and usually these are at the same time. I've done inpatient, I've done acute care, kind of run the gamut with everything. I have a great time doing it all, especially with the changes in the healthcare system over the years. Things change, which keeps you on your toes. It's exciting. I love to treat every injury. I don't have a specific thing I love to treat, but really anything that I see in my outpatient setting goes from balance to gait issues to rotator cuff tears to ACL tears to Achilles to postural deficits of a 98-year-old. Really do see a little bit of everything. Monroe is what it is, a lot of older people, but we get our fair share of high school athletes, and it's really exciting to have a kind of broad range of diagnoses to treat.
Interesting. Okay, so let's get into the questions right away. What is physical therapy?
Good question. Good way to start off. Physical therapy is, I would say, is the science of building, restoring, maintaining functional mobility through what we do: therapeutic exercise, therapeutic activity, manual therapy, neuromuscular re-education, other modalities. Our main goal is always functional mobility. Pain reduction can come with that, but I want people to understand that functional mobility is always the goal. Our job as what I would consider movement experts is to allow a patient to reach those movement milestones with our help. And yes, pain reduction comes with that. You'll get improvements in balance, improvements in posture, but mobility is always the goal. That's what we do. It's what people come to us for. And that mobility can really range. I'm sure we'll get into specifics, but that's, I would say, is a pretty decent definition of physical therapy and what we do.
Okay. What are some simple steps that can help you make physical therapy a success when working with a patient?
Well, I'd say for the patient, it's simply trust and willingness. I'd say for PT, it's similar. Trust that the patient is willing to put in the time. Be willing as the therapist yourself to put in the time. If the patient's going to do it, you have to do it as well. There's a commitment, and the thing that I preach in the office for myself and for my patients, as well as my team, is just teamwork. Yes, you're the therapist, and I do, like any doctor, we appreciate when patients trust us, but there is a team effort there. I'm not going to be the only one who solves your issue. You have to work at it. And that takes time. It takes effort. It takes a willingness on both ends. So I think having that ability to that back and forth is huge. And to building a therapeutic relationship, that goes the longest way.
Okay. And what are the different types of physical therapy?
Okay, well, it's a good question. So let's get into I kind of go off on a tangent. So you have your plain old, let's just start with this. You have your plain old physical therapists. So most of those are DPTs, Doctor of Physical Therapy. You still have PTAs, which is like an associate level degree. I can explain that more, but we don't really need to. So within that, you then have specializations within physical therapists. So you have, orthopedic specialization, vestibular, geriatric, sports, oncology. There's a few others that are not recognized by our governing board yet, but they probably will be in a number of years. And then the locations, the outpatient, inpatient, which I break up into acute being hospital and subacute being like a rehab, home health. I'd say those are your main ones. There are others, but those are the mains that people are going to see. That's the main types or locations of treatment.
Oh, I see. What is the usual success rate of physical therapy?
It's a great question. I don't have a firm number on that. I mean, I would think from what we do, in my office, I'd probably say it's a good 75 to 80%. Those numbers don't sound insanely high. I'd say therapy in general is much higher, but it's so much dependent on patient population. If you're going to see a 21-year-old who tore their ACL playing football, their success rate will most likely be 100%. Nothing's 100%. I'm going to say 99% for recovery. If I'm talking a 98-year-old with 20 years of neck pain, yeah, that's not going to be 100%. So I'd say in my clinic in Monroe, where I'm 65%, 70% Medicare, I'd say you're more 75 to 80%. And that's just sometimes, hey, issues are issues. You can't solve everything. But what I consider a success is not simply that the patient feels 100%. It's that we had goals, we met them. And sometimes those goals are not simply, we need you to run a marathon. It's like, I just want to be able to read a book without pain. So it's really where the patient sets a goal. And to me, success is really measured by those goals you set with your patients. There isn't like a specific standard we're looking for. It really is what you consider success between you and your patient.
Interesting. Usually, based on the patient population that you have at your clinic, who needs physical therapy the most?
I mean, for me, it's people 50 plus. I think they need therapy the most. And for me specifically, what I like to do is I think therapy, like a lot of things in the medical field, we need to start looking at it as a maintenance, as a prophylactic measure. You should not, I think, at 70 years old, be seeking therapy because you did something. You should be seeking therapy prior to doing something so that you don't do that thing. In teens, it's never that. It's always a reactionary, oh, I tore this, I hurt this, I sprained this, we see a therapist. I try to see a lot of my patients who are 70 plus who I know on a regular basis. I've been there for a bit. I will get them in once a year, maybe twice a year, and do a general, what I call wellness screen. Get them in, check balance, check coordination, check their gait, check their strength. Just chat with them. If I can see things then, if I can see deficits, I will then do what I can to address those deficits. But that, for me, prophylactically helps them to prevent any falls or major life changes. I think everyone can use it, but I think for most people, if you're 70 years old, you should try to see a physical therapist just to check up. There could be a lot of things that are hidden that you don't see and that experts will see. But I think it's really important for people of that age to see therapy as a maintenance as opposed to a reactionary lifestyle change.
Do you think that patients can attend physical therapy without having a referral from a doctor?
100%. So New Jersey specifically is a direct access state, meaning we can see patients without a script. A lot of that is really dependent on the insurance provider. So for Medicare, I can see an evaluation. I can evaluate a patient off the street. They will need to provide a script within, I believe it's 10 visits or 30 business days. A lot of my commercial insurance, Blue Cross, United Healthcare, Cigna, Aetna, you don't need scripts. Some of them will have like stipulations on, oh, it's 30 days, it's this, it's that. You don't need a script for the initial evaluation. Workers' comp, motor vehicle, they usually require some level of authorization or pre-authorization, so they will need a script. But for the most part, it's not really a barrier to entry. If you need physical therapy and you have a commercial insurance or you have Medicare, come in and let the experts handle the behind-the-scenes stuff. But we typically see a fair amount of patients through direct access, meaning they don't need a script.
Okay. In what ways can physical therapy help teenagers?
That's a great question. I think a big thing that we're seeing now is, obviously we're doing this now, is tech is really changing things. We're seeing a lot more, honestly, we call in the field text neck, where it's a lot of the forward posture. It's a lot of, honestly, early onset of arthritis in the thumbs, things that we probably didn't see as a profession 20 years ago. They never would have thought these things would be a big deal. So to me, it's developing proper habits, postural habits, changing how things are run in the world, especially after COVID, with people doing more, hybrid, whether it's work or school. You're going to be on your computer more. You're going to have to learn how to properly have a workstation, how to set yourself up for success, that you're not uncomfortable causing issues later. I think that's where it can be a big part. But also, again, for teens, it's like you need to have proper movement patterns. I have so many athletes who I see who they're great at what they do, but their body's trained to do that thing. It's like a runner's trained to run. They may not have the proper muscular balances elsewhere that lead to issues with other things. So sometimes simply having a therapist, and you're seeing this at schools now, having a therapist that kind of does screenings with the athletes to see where they are, what we can address to prevent further issues is a big deal. So yeah, that might not be a layman off the street, like a kid who's like, I just want to have therapy, but a lot of it is preventative. An ounce of prevention is worth a pound of cure. So like having some level of, okay, I know what my deficits are, let me address them. It really is helpful to building a proper healthy lifestyle at a young age, and whatever you want to call teenagers now. I feel like it's younger and younger now with how kids are. Even if you're 12 years old, there's no reason to not know how your body should be moving and functioning. It's a big deal, and I think that's a step PT hasn't really taken, but I think could take in the future.
Can you tell us about the different techniques and therapies that are used in physical therapy sessions?
The biggest change in general with therapy, so this kind of goes into that, is physical therapy, at least I think years ago, was almost like a passive therapy for patients. They'd come in, they'd get heat, they'd get stim. They would get a lot of these, what I call passive modalities, meaning the patient's not really doing anything, the therapist's not really. Some of that was insurance driven, insurance paid for, and let's all be honest, a lot of healthcare is what we can do. We can get a little extra money. A lot of PTs fell into those traps. They would do these passive modalities, stim, ultrasound, iontophoresis, phonophoresis. A lot of this stuff doesn't work. It's shown in the research it does nothing. It's an easy way to bill. So things that we do now are way more active modalities: therapeutic exercise, therapeutic activity, manual therapy, neuromuscular re-education. All fancy words for I'm working with the patient hands-on and the patient's also working their butt off in the clinic. Exercise, activities, mobility, stretches. There's a lot we can do. but it's a way more active approach. We're trying to get people on their feet. We're trying to get people to move properly, sitting in a chair. And yes, things will require steps. So you start small, but getting people up and moving is the biggest start. But it really ranges in terms of what we can do. Therapy sessions can contain, for one body part, you can do a million different things. It really depends on the therapist, their schooling, their train of thought, patient's deficits, the patient's tolerances. I can go on, but it really does vary.
Okay. Can you explain post-injury therapies and preventions for young athletes?
So post-injury therapy really depends on the injury. If it's ACL, you normally will have a protocol from the doctor stating, hey, this is for the 4 weeks, this is for the first 12 weeks, this is for the first 16 weeks, this is for the first 24 weeks, whatever. We're talking, progression of a year. Most protocols will be broad enough that they encapsulate what needs to be done, but never specific enough to handicap a therapist into only doing that. So you'll have your goal of that protocol is, full range motion of the shoulder or full range motion of the knee. So your goal is that in that first 4 weeks, let's say. How you get there is really your choice. Some surgeon, not really depending on the surgeon, will have a specific, I need you to do X, Y, and Z. We're seeing less of that for the most part. But you won't really have a specific X, Y, Z. It's more, hey, here's the goal in the first 4 weeks, 6 weeks, 8 weeks. Here's how you're going to get there. It leaves it up to you to how to get there. And then prevention, it's kind of what I said before, is just knowing what your deficits are, knowing what your limitations are, knowing what you can't do, and then having someone who's a professional kind of teach you how to do that. It's easier said than done for some people, and some people will never really need it. It is what it is. Not everyone needs therapy. Some people will go their whole life and probably never have it. But I think most people can benefit from, if nothing else, an information session on things and just a general wellness check.
Okay. And what are some of the symptoms that indicate the need for physical therapy?
I think we tend to, in society, we tend to think of therapy as simply a pain management technique. And I would say that's probably very much incorrect. Yes, there are conditions which require therapy because the first initial symptom was pain. But I can almost guarantee you that initial symptom of pain is not the root of the problem. It's a symptom. It's not the cause. I think a lot of patients come to us with, I have had neck pain for 20 years. I need you to fix it. Well, I can't fix the pain if I don't know the deficit. So I think for me, the first change that people should see is a mobility deficit, is a limitational deficit, is some sort of, I used to be able to do that. I can't do that. That is where I think a person needs therapy, because usually that is what precedes the pain. Some people just don't pay attention or aren't as tuned with their body, so they only sense the pain and then there they are. But for most people, it's pain. I think it has to be a mobility deficit or some sort of limitation that they just didn't have.
So how exactly can a patient differentiate between just regular pain and an underlying, cause behind it?
Yeah. Some of it is simply just knowing what you're doing. I have so many patients who, I woke up on Sunday and my back was killing me. All right. Okay. Well, what did you do on Friday? What did you do? I didn't do anything. No, what did you do? You did something. On Thursday, I was in my garden for 5 hours pulling weeds. And you don't think that had a connection. Of course it does. It's, delayed onset muscle soreness. We're talking 48 hours after an incident. Anyone who goes to the gym knows you do an exercise, you're going to have soreness in that muscle. Knowing what caused it, why you're feeling a certain way, at least in your own internal dialogue with yourself, can kind of help you differentiate, well, my back hurts, well, what did I do? Knowing the steps yourself, be your own advocate. It's very important for patients to understand why things happen. If you don't know why it happened, seek help. I mean, there are many underlying diseases or disease processes that can cause pain. You can have shoulder pain that can indicate some issue with the liver. You could have things like gout, which affect your big toe, which is nothing to do with your big toe at all, but it kind of displays as that symptom. So there are a bunch of things that are confusing, but the very first is kind of clipping maybe an internal or external journal of what you did and why you feel the way you feel. And then we can try to help you with that.
Okay. And have you ever found a correlation between therapeutic exercises and activities and the promotion of positive mental health?
100%. There is a ton of studies now, especially with the older population getting older, of Alzheimer's and what movement does to the brain. It used to be these, do crossword puzzles, do word searches, and hope your brain, stimulate responses. Well, we're seeing that with PT, we're seeing that with movement. People go through stages of life with mental health from the time you're a teen until you're older. The biggest thing for people is usually the people that go to the gym, the people that exercise, people that walk, people that have a hobby are usually in better mental states, both in terms of depression, anxiety, but also memory. So movement has a huge interplay with the brain and the release of chemicals in the brain that can help you feel better, feel more confident, have better memory. So therapy kind of falls into that range for a lot of people, but there is no doubt a huge connection between movement and mental wellness.
Interesting. Can you recommend 3 exercises that teens can practice daily?
So for me, and I think a lot of therapists, squats are the definition of what we call functional movement. You have to squat every day. I don't care who you are. Everyone uses a toilet. Everyone squats. Simple as that. So squats are the most functional movement. If you can't squat properly, especially as a teen, a deep squat is very important. I'm very big on a general deep squat. I also think lunges are important. We're working neuromuscular control, multiple firing of muscles, dynamic stability. So I'm going to say lunge. I'm going to say squat. And I'm going to just say some general upper body flexibility. Whether it's a pec stretch, we're trying to stretch out these muscles as everyone's more forward, as I am right now on the computer. Having some sort of upper extremity flexibility exercise. And we can be really broad with that. But get your body out of this posture into this posture. Whatever that is, do it, because it really is the most helpful long term.
Okay. And can you also stress the importance of hydration?
Very important. The biggest thing that I see, again, I'm specifying with my older patients, is people just don't drink enough. They don't drink enough water. Their body is not properly hydrated. We're leading to cramps. We're leading to, especially more exclusively in the winter, is episodes of dehydration. And a lot of that is you don't get the urge when it's colder out to drink as much. So people tend to not drink as much. I think the research is that we see more hospitalizations with dehydration in the winter than in the summer, and a lot of that is just the urge to drink. So hydration is important for your muscles. It's important for your cells. It's important for your brain. You need to drink. We're talking 64 ounces of water. And I like clear water. We need to stop with the Mios and the squirt stuff. Just drink water. Ice, warm, hot, just drink it. It's good for you. You need it. Your cells need it. Your bones need it. Your muscles need it. It's important. For everyone, not just older people. Teens especially don't drink enough. We're on the Stanley Thermos train, but fill those with water and stop filling them with other stuff.
Okay. And with that, we have finished the first section, and we will move on to our second section, which consists of common myths about physical therapy. Physical therapy is painful.
It's a good myth. It can be, but it has a purpose. So let's start with this. If you have a knee replacement, a hip replacement, a shoulder replacement, ACL, Achilles, I can name all of them, you're going to have pain with therapy. It just is what it is. You're going to have pain with therapy. That pain is for a purpose. No physical therapist trying to hurt you intentionally, but it comes with mobility. You have a deficit caused by a surgery. You have swelling. You have a limitation of movement. Therapy is going to hurt. But therapy in its core is not meant to that. We're trying to get gains from that level of pain. No, pain no gain isn't always true, so I don't love that moniker either, but you need to have some level of pain, but the purpose of therapy isn't painful. And that's not for everything either. A lot of things I see with my older patients, PT doesn't hurt at all. But it's not simply pain. It's pain for a reason, and it's sometimes more discomfort. But if patients understand why you're doing it, the pain doesn't matter to them. If there's a greater cause, greater good, people don't care about pain. It just takes the physical therapist to explain that properly to patients, which I don't think a lot of them do.
Okay. Physical therapy is only for injuries and accidents.
That is very, very incorrect. Like I said, I do a lot of prevention. Yes, I'd say the bulk of our patients are from an injury, from an accident, from a surgery, but there is no reason that we can't see patients prior to that injury, prior to that fall, prior to that surgery. There's a ton of research into, prehab prior to surgeries, as well as just preventative wellness. And therapy should fall into that, where we see patients on a yearly basis to check their function and to prevent worsening of that function with exercises, with different techniques, manual therapy if we need to, but it should not simply be based for injuries and accidents.
I can do physical therapy myself.
Well, you can at some point. You get discharged from therapy. We always give patients a home exercise program. So you will have exercises to do always. Those will be home exercises. So you're, quote unquote, doing therapy on your own. Do not YouTube it. Do not Google it. You can do it. You can try it. But guess what? No one's watching your form. No one's seeing how you're doing it. No one's tracking your progress. No one's tracking your proper progression or regression of that technique you're practicing. So you can do it. You shouldn't do it. I've had too many patients in the past who, I try to do this stretch I found on Google. I YouTubed a stretch for my sciatic pain and it's a little worse. Well, yeah, it's because there are a lot of nuances to everything in medicine. You need to see someone first and you need to understand the proper way to do it. And then maybe you can do it on your own. But do not trial it on your own. It's not going to go.
Okay. The next one. After you're discharged from physical therapy, you're healed.
Well, I'd like to think that a lot of people are. And typically they're not. You get to a state of therapy where you've maxed out your functional gains, but there is a level of maintenance that you have to undertake to prevent things from getting worse. So you might be cured from your actual issue that brought you in for therapy, but there is now for some people, a lifelong need for continued exercise, mobility, and that requires some level of autonomy as a patient to say, well, I know I need to do this. It's not every day, but it is a very specific regimented plan that your physical therapist came up with to prevent relapse into those issues or further issues.
Okay. And with that, we have finished the myth section and we will proceed to our last and final section. Let's start with a scenario. Let's say that an individual is doing their regular exercise routine and they notice a sharp pain in their knee. What can the individual do in this particular situation?
Well, it starts off with, let's just get the basics here. If you're doing exercise, you feel pain in your knee, move your knee. If you have a level of pain that you can replicate with a consistent movement pattern, okay, now you know the trigger. Then you need to figure out what we can do to ease the pain. So we have an aggravating system, we have an easing system. We need to know what the aggravating system is, then better know how to ease it. If you bend your knee and the knee bending causes pain, and we have to differentiate pain too, whether we have soreness, sharp shooting pain, stabbing, dull, achy, throbbing, numb, whatever. That really starts the process of where we have to go. If you can replicate the pain with a consistent movement, most of the time for people, that's going to be muscular. If you can't replicate it, sometimes that can be joint related. But I usually tell people, start with a regimen of I like ice first. I tend to be more of an anti-inflammatory person first. If it hurts, get off of it for a minute, try some ice, try some general stretches for whatever it is. If it's not getting better, then we need to seek help, but try to heal yourself a little bit first. And sometimes that just requires getting off of it, knowing what aggravates it, also finding out what eases it, and then having that information going to your therapist or going to your doctor is really helpful. They can kind of put you in the right direction.
Okay. Can you tell us about a special case that you've dealt with, which you found to be intriguing or unique?
It's a good one. Unique. I wouldn't say my specific stories are probably unique. Working in a bunch of different fields, I've seen a lot of things, but so have a lot of other therapists. I guess intriguing. Some of it is just the situations can be really intriguing. So I was working in a hospital in Pennsylvania. There was a man in his 50s who came in. He was a steel worker. He was working on the line. He got a little shard of steel under his thumbnail. He pulled it with like a pliers, needle nose pliers. He pulled it. Everything was okay. He felt okay. 2 days later, gets out of bed in the middle of the night, goes to sit on the toilet, do his business, tries to get up, and he can't. He had what ended up being a massive infection from this steel splinter that went right to his spinal cord. He became a paraplegic. We're talking like nipple line down, no sensation, no movement, nothing. The case was interesting, as I was a young therapist at the time. This was mentally just tough for this guy to handle. He was 50 years old, three daughters, complete lifestyle change. He was an amazing person. He was so willing to do anything he needed to get mobility back. But as a therapist, I'm like, oh God, where do we start? Like, you're looking at so many different angles here, physical, mental. You're talking in a complete lifestyle change that requires every possible MD in all these fields looking at him. So I felt a little overwhelmed in the sense that, like, I'm a big part of this because he needs mobility back, but until he's stable from a medical standpoint, I can only do so much. I found that case really interesting, but it was really rewarding at the end. He's actually doing really, really well. He's very functional. He's actually done some like Paralympic style activities in his hometown. He's a pretty amazing guy.
That was a very interesting case. Okay, so we will now go on to our final question. What is your take on Google Doctors?
I think it is very important to be your own advocate. I think it's very important to know what you're dealing with, to know your symptoms, to know how you feel. the public should not be misinformed. The public should also be knowledgeable. Having a baseline of understanding is important. Everyone needs to have it. But on the flip side, you are a unique individual with your own unique DNA, your own unique genes, and your condition, injury, won't always portray itself as the same for everyone. So I don't care if you have an issue that is textbook and you Google it and you may get the right answer and you may see, oh, actually I'm doing, this thing I found on Google did help. But there could be an underlying issue that caused that problem. And now we've missed that because you tried to treat the symptom and not the cause. So I'm very big on advocation, especially for my older patients. We are out of the generation of my doctor said this, I'm going to do this. It's not healthy. We don't need to be doing that anymore. But on the flip side, you are not the medical expert. You should know things, but you should also be willing and able to listen to the professionals on how to assist you in that process. But ask questions. Don't portray it as a way that you know everything, but ask questions. You should question your doctor, not in a mean way, but you should always be willing to ask questions and say why. You need to be informed, but please don't confuse your Google search with someone's degree. That is an unbelievably unfair thing to do to people in any field who train. It just isn't the right thing.
I agree. And with that, our podcast session has now come to a close. I would like to thank you once again for your time, input, and contribution. And for our listeners,
please nourish your habits to flourish your lifestyle.
Thank you. And don't forget to follow us on our website, HealthyTeens.net. And stay tuned until the next episode.
Thank you. Everyone have a great one.